right, I'm in chapter 33 of the Fundamentals book, and we're going to talk briefly about coping. So, I would be familiar with the three stages of General Adaptation Syndrome, or GAS. The first stage is the alarm reaction stage, which is where your body basically mounts a fight or flight reaction. During this time, heart rate is increased, blood pressure is increased, and cortisol is released in the body, and you get this boost of adrenaline to help you deal with the stressor. The second stage is the resistance stage. So this is where the body works to normalize hormone levels and vital signs while still responding to the stressor. And then the third stage is the exhaustion stage. And this is where prolonged stress results in the body no longer being able to respond to the stressor. So results in this stage include fatigue, illness, and depression due to that prolonged stress. So when you are helping your patient with their coping skills based on their current situation and a stressor, it's really important that you ask them what coping skills they have effectively used in the past. Because if you can kind of zero in on what coping skills have been successful in the past, those same coping skills may help the patient with their current situation. So I definitely remember that. Chapter 34. Chapter 34, just going to talk really briefly about that. Talks about self-concept and sexuality. I would just be aware that certain invasive procedures or medical conditions can result in an impaired body image. So things like amputation, mastectomy, hysterectomy, and loss of body function due to arthritis, spinal cord injury, stroke. These things can really impact a patient's sense of self-concept and their body image. So if you have a patient who has a new ostomy, for example, and that's a pretty traumatic thing when someone comes out of surgery with a new ostomy and they weren't aware that they were going to need one. There are some patients who refuse to look at it, refuse to empty their ostomy bag or take care of it. They just don't even want to accept that it's there. That would be an example of impaired body image. So it definitely happens, and you just, as a nurse, need to be aware of that and sensitive to that. So that's the main thing I wanted to talk about in chapter 34. Chapter 35 talks about cultural and spiritual nursing care. So I would be familiar with some cultural considerations for nursing care. So for Orthodox Judaism, I would be familiar with the fact that they require kosher kitchens. They do not eat meat with dairy. So like a cheeseburger would not be appropriate for this patient. They also do not have pork products or shellfish. So if you're given a question, for example, which of these menu items would be appropriate for somebody who's an Orthodox Jew? You would not choose a cheeseburger. You would not choose shrimp or pork. Those would be off the table. Islam, people who are part of that culture often do not drink alcohol or eat pork. They often fast during Ramadan. In many cases, the women will require a female provider, and they also may pray 5 times a day or more. If you're a Jehovah's Witness, some Jehovah's Witnesses do not accept blood products. So this is where you might get a question about a patient's right to autonomy. So if you have a patient who's a Jehovah's Witness who is requiring a blood transfusion that they do not want to have based on religious considerations, as long as they're competent, they're an adult, they're not impaired, they have the right to refuse that treatment, even if it results in their own death. They have that right to autonomy. So I definitely remember that. Mormons typically don't have caffeine or alcohol, and Catholics sometimes will fast during Lent. So another thing a term I would be familiar with is ethnocentrism. So ethnocentrism is the belief that one's own culture is superior to all others. So these people view the world from their own cultural viewpoint. So it's really important as nurses that we do not demonstrate ethnocentrism. So we don't want to project our values and our cultural beliefs on other cultures and other people who have different belief systems. So we really want to be sensitive to their cultural needs and to their beliefs when we're providing nursing care. So if we can assist with like menu things, some of the things we talked about, like no cheeseburgers, etc., those are things we can easily work with. Allowing for praying 5 times a day. If we can work with the patient and with their cultural considerations, that's always best when caring for the patient. And then the last thing I want to talk about in chapter 35 is the use of an interpreter and do's and don'ts. So you do not want to use the patient's friend or family member as an interpreter. You do want to use a certified medical interpreter. You can either have that interpreter like be in person, or you can use like a special phone to call up an interpreter. You always want to explain the purpose of the meeting to the interpreter prior to approaching the patient. You want to make sure you direct your questions at the patient or their family, not the interpreter. And then you want to ask one question at a time. You want to use layman's terms, meaning you don't want to use like medical jargon. You want to keep it simple and your language understandable and simple. And you do not want to supplement words with gestures or nonverbal reinforcement. So you really want to let your words speak for themselves. Don't try to play charades, right, and try to do gestures. Just speak clearly and let the interpreter interpret your words. So that is it for chapter 35, and we will pick it up with chapter 36 in my next video. Thanks.